If you are older and do not ejaculate, do so immediately. Urologist Explains. Dr. Narita. The journey through life brings with it an evolving landscape of experiences, and for many men approaching or gracefully navigating their golden years, specifically those over 50, 60, or even beyond, certain intimate moments can unexpectedly shift, presenting a puzzle that often breeds quiet concern. You might find yourself in a situation where the profound sensation of climax, that peak of pleasure, is undeniably present and as vivid as ever, yet the expected physical accompaniment, the release of seminal fluid, is noticeably absent or significantly diminished. This particular phenomenon, far from being a trivial matter, carries a weighty significance, making this message not just important, but absolutely essential for your peace of mind and overall health. Perhaps this experience has only occurred once, a singular, startling event that instantly knotted a sense of worry deep in your stomach, sparking a cascade of unsettling questions about your body and what this change might signify. Or perhaps, for some, it has become a recurring, silent issue, a private concern that you've been carrying alone, perhaps shrouded in a quiet sense of shame or a creeping fear about its deeper implications for your health and vitality. It's a deeply personal matter, one often discussed in hushed tones, if at all, and it taps into fundamental aspects of male identity and well-being. I am Dr. Narita, a urologist who has dedicated the past 12 years of my professional life to focusing intently on men's vital health across every stage of their lives, from early adulthood through the senior years, understanding the unique challenges and changes that unfold. Today, my intention is to engage in a conversation that is unequivocally serious in its medical scope, yet profoundly supportive and reassuring in its tone, aiming to demystify this experience and empower you with knowledge. My first and most crucial point of reassurance is to let you know unequivocally that I deeply understand the concern that such a change can provoke. The alteration you are observing in your body, this unexpected shift in an intimate process you've known your entire adult life, is absolutely not a definitive sign that your masculinity has expired, nor does it mean that your intimate life is irrevocably over. On the contrary, it's vital to reframe this perception. Rather than viewing it as a failure on your part or a decline in your inherent potency, it is far more accurate to conceptualize it as a detailed, intricate message your body is diligently sending you. This message, while perhaps initially alarming, simply requires careful decoding and understanding, much like an intricate code that, once deciphered, reveals critical information. I urge you to stay with me through the entirety of this discussion because, over the next few minutes, we are going to meticulously explore the often surprising underlying causes of this phenomenon, delve into the critical warning signs that necessitate immediate attention, and most importantly, illuminate the clear, manageable, and highly effective solutions that modern medicine now comprehensively offers. These solutions are designed not just to address the physical symptoms, but to profoundly restore your peace of mind, reinvigorate your confidence in your own body, and significantly enhance your overall well-being and quality of life. Before we delve into the specifics of what occurs when seminal fluid is absent during climax, let us first take a moment for a brief yet insightful, non-textbook exploration of how this intricate process should ideally unfold under normal physiological circumstances. Envision your body's reproductive system as a remarkably complex and perfectly timed orchestra, where each instrument and section plays a precisely coordinated role to achieve a harmonious and powerful crescendo. At the heart of this system, the testicles diligently produce sperm, the foundational component. Complementing this, the seminal vesicles, a pair of sac-like glands, contribute the vast bulk of the nourishing, fructose-rich fluid that provides energy and motility to the sperm. Following this, the prostate gland, a small organ situated just below the bladder, adds its own protective milky fluid, which helps to activate the sperm and guard it within the vaginal environment. This meticulously prepared final cocktail of sperm and fluids is then expertly gathered and held in in readiness within the urethra, the very same tube that carries urine out of the body. When the moment of climax arrives, a remarkable and rapid sequence of events is triggered. A series of specific, powerful muscles, primarily located at the base of the penis and around the urethra, contract in a rhythmic, pulsatal sequence. This synchronized muscular action acts like a pump, propelling the fluid mixture vigorously forward and out of the body. This entire rapid event, lasting only a few seconds, is the breathtaking result of an incredibly delicate and synchronized timing between a complex network of nerves, a multitude of glands, and the precise contractions of these specialized muscles. Any disruption in this finely tuned symphony can lead to variations in the expected outcome. Now, here is a profoundly crucial distinction, gentlemen, one that often causes confusion and anxiety. The terms climax and ejaculation are in fact not synonymous, though they are often used interchangeably in common parlance. While they typically occur almost simultaneously throughout most of a man's life, they are fundamentally distinct physiological processes. Climax refers specifically to the neurological sensation of intense pleasure, that profound and exhilarating peak experience. This sensation is entirely governed by your brain and the intricate network of your nervous system, a cascade of neurochemicals and nerve signals. Ejaculation, conversely, is the purely physical act of expelling seminal fluid from the body. For the vast majority of your life, these two distinct events happen so seamlessly as one unified experience that it's natural to perceive them as a single entity. However, it's imperative to understand that they are actually driven by separate, though interconnected, physiological mechanisms. Our precise focus today is on the phenomenon known as dry ejaculation. This is the accurate technical and medical term for the situation where a man reaches that characteristic peak of pleasure, the climax, yet distinctly observes that little to no seminal fluid is released. In the quiet confines of my office, patients frequently describe this experience using phrases like an empty orgasm or a climax without a follow-through. And it's this unsettling gap between the deeply ingrained expectation and the surprising reality that so profoundly fuels worry and distress. And I want to reiterate, I completely understand why this is such a source of anxiety. You have for decades expected a tangible physical sign of this intimate event, a visible confirmation of its completion. But it is absolutely vital to grasp this fundamental truth. Your innate ability to feel pleasure, to experience the full intensity of climax, can and often does remain entirely intact, precisely because it is governed by your nerves and your brain. The change, when it occurs, is specifically within the mechanical delivery system, the intricate plumbing designed to transport the fluid. This reality does not, in any way, signify a loss of your virility or your inherent masculinity. It simply means that a particular part of your body's complex plumbing system has a specific, identifiable, and often treatable reason for this unexpected alteration. If you are finding this detailed information helpful and genuinely valuable in illuminating aspects of men's health that are often overlooked, I earnestly ask you to please consider sharing this message with a friend, a father, or a brother who might benefit, and supporting this content helps reach more men who need this information. Now let's proceed to systematically break down the three most common and frequently encountered causes of dry ejaculation. Comprehending the why behind this experience is not merely an academic exercise. It is in itself the crucial first step toward regaining a profound sense of control over your body and your peace of mind. The primary and most frequently observed cause, accounting for a significant percentage of dry ejaculation cases, is known technically as retrograde ejaculation, or as I often explain it, the gatekeeper is too relaxed. To grasp the underlying biology, envision a small yet vitally important muscular valve located precisely at the internal exit of your bladder. During the highly synchronized process of climax and impending ejaculation, this muscular valve, acting as a diligent gatekeeper, should normally clamp down with considerable tightness. Its essential function is to ensure that the seminal fluid, now prepared for expulsion, has only one unobstructed pathway to follow, forward and out of the penis. If, however, for various reasons, this crucial internal sphincter or valve is too relaxed, or its muscular integrity has been compromised, the path of least resistance for the seminal fluid changes. Instead of being propelled forward, the fluid, following the easiest route, flows backward into the bladder. While you will unequivocally experience the full neurological pleasure of climax, the physical sensation of expulsion will be absent, leading to that characteristic dry feeling because no fluid exits the body. A common, though typically non-alarming, practical clue that often accompanies retrograde ejaculation is noticing that your urine appears somewhat cloudier than usual shortly after intimacy. This observable change occurs because the seminal fluid, having flowed backward into the bladder, is now mixing with the urine, altering its appearance. The practical causes behind this phenomenon are varied but often specific. This condition frequently arises as a consequence of certain surgeries performed on the prostate or bladder. While these surgical procedures are often successful and absolutely necessary for your health, they can inadvertently affect the delicate nerves or the muscular integrity of the bladder neck, which precisely controls this internal gate. Furthermore, retrograde ejaculation is a well-documented and known side effect of specific medications. These include, but are not limited to, certain alpha blockers frequently prescribed to manage conditions such as high blood pressure, hypertension, or to alleviate symptoms associated with an enlarged prostate, benign prostatic hyperplasia, or BPH. These medications, while effective in relaxing smooth muscles in blood vessels or around the prostate to improve urine flow, can also, as an unintended consequence, relax the tiny smooth muscle responsible for clamping down that internal bladder neck valve. I recall a particular patient, a man of immense pride and dignity, who was utterly distraught and profoundly confused after undergoing a successful prostate surgery. The physical recovery was going well, but the unexpected change in his intimate life left him feeling profoundly incomplete. When he was able to understand that this was purely a mechanical alteration, akin to a traffic light being stuck permanently open rather than closing at the appropriate moment, and crucially, that his innate desire, his capacity for pleasure, and his ability to experience climax were completely unaffected, he felt an immense wave of relief wash over him. This understanding transformed his anxiety into a sense of renewed hope and acceptance. Our second major cause for dry ejaculation, which I often describe as the plumbing is blocked, centers around duct obstruction. In this scenario, the biological process is slightly different from retrograde ejaculation. Here, the seminal vesicles and other accessory glands are continuing to produce seminal fluid normally, just as they should. However, the problem lies in the delivery system itself. Imagine the small, intricate ducts through which the seminal fluid must travel as a series of delicate delivery pipes. If these crucial pipes become blocked, either partially or completely, then the delivery vehicle, the seminal fluid, simply cannot pass through to be expelled. Consequently, the volume of fluid released drastically decreases, or in some cases, disappears entirely, even though the production within the glands remains perfectly fine. The practical causes for these blockages can be diverse. One common culprit is the scarring left behind by past infections, particularly severe or untreated cases of prostatitis and inflammation of the prostate gland. Such infections, especially if chronic or recurrent, can lead to fibrosis and scar tissue formation within or around the ejaculatory ducts, effectively narrowing or closing them off. Less frequently, tiny calcifications, akin to very small stones, can form within these ducts and mechanically block the passage of fluid. These microcalcifications can sometimes be remnants of previous infections or simply mineral deposits. The practical signs and symptoms associated with duct obstruction can often be subtle, making diagnosis sometimes challenging. Some men may report a new mild discomfort or a dull ache in the pelvic or perineal area, specifically during climax, as the system tries to expel fluid against resistance. Alternatively, they might have noticed a progressive change in the quality of their ejaculate over an extended period, observing that the fluid has become consistently thicker, more viscous, and less abundant, gradually diminishing in volume. The excellent news for men experiencing this particular cause is that many of these obstructions are entirely treatable and can be effectively cleared. Often, treatment involves medication to manage any underlying inflammation or infection that might be contributing to the blockage. In other cases, if medication proves insufficient, minimally invasive procedures are available to physically clear the obstruction and restore the normal, unimpeded flow of seminal fluid, thereby returning the ejaculatory process to its healthy function. The third significant area that warrants thorough investigation when dry ejaculation occurs pertains to hormonal factors, specifically focusing on the impact of low testosterone, which I often term the fuel is low. From a biological perspective, testosterone is far more than just the primary hormone regulating libido and sperm production. It is, in essence, the fundamental fuel for the entire male reproductive system. Its influence is pervasive and critical for the optimal functioning of various key components, most notably the prostate and the seminal vesicles, which are responsible for contributing the bulk of the seminal fluid volume. When testosterone levels experience a significant and sustained drop, the entire intricate male reproductive system begins to slow down. This systemic deceleration directly impacts the secretory activity of these glands, leading to a reduction in the production and volume of seminal fluid. Beyond the physiological changes, the emotional and experiential impact of low testosterone can be profound and far-reaching. Initially, a man might observe a noticeable reduction in the volume of seminal fluid, often the first tangible symptom prompting concern. However, as this hormonal deficiency persists and progresses over time, its manifestations become broader and more impactful. Men frequently report a marked decrease in libido or sexual desire, a reduction in the firmness of their erections, and a generally less intense or satisfying sensation during climax, diminishing the overall quality of their intimate experiences. On a broader systemic level, the impact of low testosterone extends beyond the reproductive system. Men often experience persistent fatigue, a pervasive lack of energy that isn't relieved by rest, alongside significant mood changes, including irritability, depression, or a general lack of enthusiasm. Furthermore, a noticeable loss of muscle mass and an increase in body fat, particularly around the abdomen, are common indicators. The practical solution for this condition is often straightforward and highly effective. This constellation of symptoms, when confirmed by appropriate testing, is typically indicative of a condition known as hypogonadism, which is a treatable hormonal deficiency. If a simple blood test confirms clinically low testosterone levels, a carefully managed hormone replacement therapy, HRT, can be initiated under expert medical supervision. This therapeutic approach can often achieve remarkable results, not only restoring better seminal fluid production, but also significantly improving energy levels, rekindling sexual desire, enhancing erectile function, and markedly improving overall quality of life. It is a critical mistake to simply attribute these significant symptoms and changes to the inevitable process of just getting old. While aging naturally involves hormonal shifts, clinically significant deficiencies warrant investigation and treatment, as they are not merely an unavoidable consequence, but an identifiable and manageable medical condition. While the vast majority of cases of dry ejaculation stem from the manageable causes we've just discussed, as your doctor, I bear the crucial responsibility of also addressing the critical exceptions. It is imperative to understand that dry ejaculation can, in some rare instances, serve as a significant red flag for a more serious underlying medical condition. This is precisely why paying meticulous attention to any accompanying symptoms is absolutely crucial for your health and safety. You should make an appointment to see me or any urologist immediately if dry ejaculation appears suddenly and without any clear explanation, especially if this sudden onset is accompanied by additional concerning symptoms. These critical warning signs include pain during intimacy or ejaculation, the presence of blood in your urine, or more rarely, in any residual fluid, the development of a fever without a clear cause, or critically, any loss of sensation in the genital area. If any of these accompanying symptoms manifest, you must not delay seeking professional medical attention. These are powerful signals that unequivocally require an urgent urological evaluation to rule out potentially serious conditions. For instance, certain neurological diseases, such as Parkinson's disease or long-standing uncontrolled diabetes, can significantly interfere with the complex nerve signals that orchestrate the ejaculatory process, leading to dysfunction. In extremely rare but important cases, specific urological cancers, though not typically presenting primarily with dry ejaculation, can potentially interfere with the plumbing or nerve pathways, necessitating thorough investigation. Beyond the purely physical manifestations and medical diagnoses, we must never overlook or underestimate the profound emotional toll that experiencing dry ejaculation can inflict on a man's psychological well-being. For many men, the tangible presence of seminal fluid during ejaculation has been deeply equated with their performance, their potency, and their very sense of virility and masculinity throughout their adult lives. When this expected physical manifestation disappears, a cascade of intensely difficult feelings can take root. Feelings of inadequacy, often accompanied by pervasive anxiety about future, intimate encounters, and profound frustration with one's own body are common. It is not at all unusual for men wrestling with these internal battles to begin actively avoiding intimacy altogether, driven by an overwhelming fear of being judged by their partner or by an internal sense of feeling incomplete or somehow less than. This emotional burden can be as heavy, if not heavier, than the physical symptoms themselves, impacting relationships and overall quality of life significantly. However, there is immense emotional reassurance to be found, and the single most important step toward breaking this potentially debilitating cycle of worry and avoidance is the acquisition of accurate information combined with open communication. Understanding unequivocally that this is a physiological change, a mechanical or hormonal alteration within the body, and not a personal failure, lifts an enormous and oppressive weight from a man's shoulders. It is a fundamental truth that your inherent ability to feel pleasure, to achieve and maintain erections, and to enjoy deep, meaningful connection and intimacy with a partner does not solely depend on the presence or absence of seminal fluid. Your intimate life, in all its richness and complexity, can and absolutely should remain a vibrant and fulfilling source of joy, connection, and profound satisfaction, irrespective of this particular physical change. To conclude this vital discussion, I want to provide you with a clear, supportive, and actionable plan designed to help you proactively take back control of your health and well-being. Firstly, and crucially, don't ignore it, investigate it. A sudden onset or a progressive, noticeable change in the ejaculatory process warrants a prompt visit to a qualified urologist. Often, a simple yet comprehensive medical history, a thorough physical exam, and in many cases, routine blood or urine tests are all that are typically needed to arrive at a clear and accurate diagnosis, setting you on the path to understanding and treatment. Secondly, commit to controlling any underlying chronic conditions. Conditions such as diabetes, high blood pressure, hypertension, and high cholesterol directly and profoundly impact your overall vascular health and the integrity of your nerve pathways. These systems are intimately involved in orchestrating the entire ejaculatory process. Diligently managing these chronic conditions through appropriate medical care, lifestyle adjustments, and medication is not just good for your general health, but it directly contributes to the optimal functioning of your reproductive system. Thirdly, break the silence. This is perhaps one of the most liberating steps you can take. Talk openly and honestly with your partner about what you are experiencing and feeling. Their understanding and support can be invaluable. Equally important, discuss your concerns openly and candidly with your doctor. Speaking about what you're feeling, both physically and emotionally, is incredibly liberating and powerfully paves the way for effective solutions and renewed peace of mind. Remember, professional medical support, whether it involves a simple adjustment to an existing medication, the initiation of a new therapeutic regimen, or a specific medical procedure represents your best and most effective tool for restoring confidence, addressing the underlying issue, and reclaiming your vitality. In summary, gentlemen, the absence of seminal fluid during climax is definitively not the terminal end of your intimate life, nor is it a final verdict, proclaiming lost masculinity or diminished worth. Instead, it serves as a distinct and important signal emanating from your body, a message that profoundly deserves to be heard, understood, and thoroughly investigated with the expert help of a medical professional. Comprehending the precise cause, whether it ultimately proves to be a mechanical issue, an obstructive challenge, or a hormonal imbalance, is the foundational first step towards finding genuine peace of mind and regaining a sense of control. Throughout my extensive career, I have had the privilege of witnessing countless men regain not only their physical confidence and renewed vitality, but also their profound joy in living, all after receiving a clear, accurate diagnosis and a well-defined action plan tailored to their specific needs. Your true vitality, gentlemen, is fundamentally not measured in mere milliliters of fluid. Rather, it is measured in the holistic tapestry of your health, your overall well-being, and your inherent capacity to live life fully, engage deeply, and connect meaningfully with those you cherish. Do not, under any circumstances, allow doubt, shame, or fear to prevent you from actively seeking the answers and solutions you deserve. Taking proactive action in a timely manner can absolutely and completely transform your intimate experience, restoring the deep security, profound connection, and joyful intimacy that is your birthright. I invite you to stay connected for more invaluable content on men's vital health. Always remember, your best, most vibrant years can still be ahead of you. Be proactive in your health, be confident in seeking answers, and may you stay blessed in your journey. I'm Dr. Narita, and I look forward to connecting with you in our next discussion.